Thank you, Rodney. We just started recording the meeting. Dr. Charlie Kyle is our Assistant Superintendent for Administrative Services, overseeing our high schools and human resources. We also have Christy Kuntz, who's our Director of Human Resources, with us today. Bill Farley, our Assistant Superintendent for Business and Operations. So he oversees, like he calls Meals and Wheels, transportation and food service. Mrs. Melissa Murphy, she's our Assistant Superintendent for Educational Services. Dr. Chris Salagi, our Assistant Superintendent for Student Services. Chris has been overseeing a lot of our physical distancing, health, and SEL work. And then Rodney Mack, who is our Executive Director of Technology. So I'm just going to walk through a couple of things on the agenda. Then I'm going to stop sharing my screen, and I'm going to jump over to looking at the chat bar. And we'll get to start answering your questions. So under the important links section, you'll find several links. First is the reopening presentation, the slide deck that was shared at last night's board meeting, along with the link to the July 8th board meeting video. Starting at the 1 hour 31 mark is where you will see the start of the presentation. And I will just say from the onset, we acknowledge and apologize for the audio issues that we had last night. I know it was very difficult in some spots of that presentation for people to hear. This was our first time doing a live stream too, and the way that we had thought we were able to do it and had practiced, it didn't work. And so we had to quickly pivot and only show the video of the slides, and then also had to use a different audio format. And so please know that if we do live stream any other board meetings, that we are working quickly to get those issues resolved. So thank you for your patience on that. You'll see a link to our reopening section of our website. And then there's a link to an unfinalized reopening document. So that reopening document, following this meeting, if you didn't get a chance to look at it, contains a lot more detail than was shared last night. That document will eventually be turned into kind of what I'm calling more of like a glossy official reopening document that will have a table of contents, headers, and easily make it more consumable, the information, but then also allow staff and families to quickly, it's almost like a reference guide. So you can quickly flip to various sections to find answers to some of your questions. And knowing full well that we will probably be adding to that document as well. And so as we build out more details, as we continue to work through a lot of that. So the way it's going to work is this meeting will be about an hour long, so we'll probably wrap up around 10 o'clock. We're asked that everybody will remain muted other than the hosts. If you have a question, please put it in the chat bar. Please also list the name of your building. So for example, my name's Erica Loiacono, and then I would work the school service center. Messages will be sent to hosts, but can only be sent to hosts, but please make sure to send them to me, because if you send it to like Dr. Schuler or Melissa Murphy, I won't see those, so I won't be able to make sure that those questions are asked. We will ask questions in the order that they are received. But if we feel that your question has already been answered, we will move on to the next question. Because we're recording this, I will be able to download a transcript of the chat bar. So if you have a building specific question, we'll notate that and pass that along to your building principal. And then finally, if time did not allow for your question to be answered, please email the communications@cusd200.org email address, and I will be we will be working on creating a staff FAQ document. And then also that will allow us to farm those questions out to the most appropriate person. So I am going to, excuse me, I am going to stop sharing right now. And then I am going to jump over to the chat bar and we're going to get started.
Erica, while you're doing that and reading the first question, there is one area that I just wanted to mention at the onset, because this was not covered in the presentation last night, but want to be very specific about it. So after today's Q&A and after the communication coming out today, one of the things that you can expect to see by the end of this week as a staff member is a survey that will come to each staff member. So a number of the questions that we've received very early on are questions from staff members saying, how is this going to work if I have an underlying medical condition or a concern or an underlying medical condition in my family that would make my return to in-person instruction in a building a situation that can't happen. And so the survey that you're going to see at the end of this week is going to help us begin to work through those pieces. So we have across the district, we've reopened the school service center to all of the employees at the school service center. We reopened this week our middle and our high school offices to those that are working in the office. And obviously with less employees, we've been able to handle those situations individually, right, through asking people to contact the human resource office. What we're going to do, because we've got 1,800 staff members out in our buildings, is we're going to use that survey to help us get our human resource department in contact with you to work through those concerns. So whether it be a request for an individual accommodation within the work environment, just a specific concern you have that we can work through and accommodate, and or a situation where somebody is either contemplating a leave or a request to teach only in our remote or our e-learning opportunity. That survey will help us to begin and to trigger those conversations. So we anticipate knowing in the next 2 weeks how many students or families will elect to do only e-learning in the fall, which obviously is gonna then kind of help us to identify how many staff we will need to be able to provide service in that space. And so exactly how it is that we might be able to accommodate all staff members, I have to tell you, honestly, I don't know the answer to that, but we want to begin to work with you through those conversations. So again, understand you'll get that survey. It will ask questions about obviously staff members that may have a child care issue, may have an underlying medical condition that we need to work through, and candidly just specific concerns that you have that we want to make sure we can address for you either through training opportunities, through our work teams that are working through some of those details. So that is coming end of this week.
Thank you, Dr. Schuler. And one other person I'm so sorry I did not recognize that is a co-host on this call is Erica Ekstrom. She is our Executive Director of Special Education, so that she can be available to answer any of those specific questions related to special education. So first question is, I'm going to, Melissa Murphy, if you could please unmute yourself. Barb Bussman from Sandburg. How will virtual academy supervisors, teachers be chosen?
You know, actually, I would say that would be a question that maybe Dr. Kyle should answer.
Okay.
Yeah, so like Dr. Schuler just said, right now we're working with the WWEA and the HR subcommittee, which is made up of WWEA leaders and some administrators, on a survey that should go out at some point on Friday this week. We want to get the information from faculty and staff. Obviously, underlying conditions is important. Age, we look at different variabilities. The biggest thing too is going to be looking at how many students choose the online academy e-learning option all year. If a lot of students choose it, then we need a lot of teachers. If not a lot of students choose it, we don't need a lot of teachers. So we're going to try and balance those pieces out. But the survey is really going to help us through HR to make sure that we contact each individual that has underlying health conditions and try and match as best as we can the need for e-learning and the amount of teachers we will need. So we are working on that. One of the things I will say with the e-learning opportunity at elementary, middle, and high schools, it's not necessarily at their own school. It'll be teachers dedicated to people, and we're still working through kind of what those numbers would look like. Elementary would probably be like an average class size, but high school, middle school, it'll depend as we get the numbers from how many students enroll in that online academy / e-learning option.
Thank you. And Dr. Kyle,
Charlie,
the next,
oh,
go ahead.
can I add on to that? I'll also say thank you, Dr. Kyle. Another thing to note would be once we have the names of students that have selected the virtual academy, Julie Ozymkowski is going to do a data match, so we know the student needs, and we'll be able to do a match with the kinds of staff and needs of students as well.
Dr. Kyle, the next question is probably for you too, related to Virtual Academy from Julie Banta. If someone takes a Virtual Academy position, will they get their former position back in their home school when the Virtual Academy is no longer offered?
Oh, I mean, you know, obviously what we're setting up for this year is because we're in the middle of a pandemic. So if we need somebody to do a virtual academy, whether that be elementary, middle, or high, they still have a job if there's a vaccine and we go back to normal. The issue is we don't have a vaccine, so we're planning for the 2021 school year. But the answer, quick answer to your question is, yeah, if we go back to normal, we go back to the way things were. We all want that. I just don't know when that's going to happen.
This next one may be for both Charlie and Melissa. If a specialist EL teacher chose to be a virtual teacher, what happens to the school's EL department? How does that affect the students' minutes?
Well, this is all part of that staffing process. And so we're going to have to look really carefully at every building and building's needs and determining what the best fit is for Virtual Academy so that we don't leave any building short on the services that our students need. We wouldn't want our students at the building not to receive the EL services that they need.
So I think tying these two pieces together, Melissa and Charlie, I think fair to say that the assignment of some staff into the virtual academy may mean that we do then some hiring at an individual building to backfill a position as well. So just the assignment of a staff member to the virtual academy does not mean that there is a need that will go uncovered at a building.
Thank you. The next question is for Mr. Farley. This is from Angie at Sandberg. Being in a hub room with no windows, what are we doing about proper ventilation, especially with the talk lately about aerosols lingering in the air?
We are looking through our operational committees and our operational standards and practices to upgrade our systems. We're going to be running them longer. We're going to be airing out buildings as much as we possibly can. Obviously, you're in a room that doesn't have a window, but we are encouraging staff to open windows when it's appropriate. But we will be increasing our ventilation and our filter systems to try and make sure that we're exchanging air properly and introducing as much outside air as possible.
And there is a slide on the presentation from last night. It's closer to the end, probably the last third of the presentation, that provides a high-level answer to that as well. The next question I'm going to direct to Dr. Szilagyi. Aaron from Sandberg, will students still leave their classrooms for PACE?
Yes, students will still have the opportunity to leave their classrooms for PACE. First of all, hi everybody. Wish I could be with you in person. Yeah, students will still, at this point, the plan would be to have them to be able to leave their classrooms for PACE. Certainly, masks will have to be wore at all times during the school day, but they would still be able to leave their classrooms for PACE.
Can you talk about how that's a little bit different, maybe, perhaps, than some of the other specials?
Yes. So a few pieces. One, in the PACE classroom, desks will have to be 6 feet apart. So one piece, and you have smaller cohorts of students that are transitioning, but that transition again is going to take less than 15 minutes in the hallway. So certainly that transition can happen as long as we're going to be planning who those students are and where they're going. So obviously something like PACE differs from other specials, like a PE, right? Where we'll still be going to a PE, but there's different pieces, and we have a team that's working on what will PE look like. So the other piece is the multiple groups of students that are moving in and out of a classroom. I guess that would be one of the differing factors, but answer the question is yes, students will still have PACE.
Thank you. This question is probably for Dr. Kyle, from Laura Whitnabin-Tufte at Whittier. Will there be modifications to the schedules of teachers who travel between buildings to minimize contact with multiple school populations and staff at multiple schools? So I know Laura is an art teacher, for example, at Whittier and Longfellow. So I'm guessing that's where that's coming from.
Yeah, I just wrote that down because that's obviously, there's a lot of questions, like Dr. Schuler said, that we haven't looked at. I would have to kind of look at that and speak with other people to get an answer to that. I don't have an answer to it right now. I would probably need a little more information. So I'm going to take your name down and get in touch with you just to ask, get some clarification so we can get an answer to you.
Thank you. Dr. Szilagyi, I'm going to direct this next one to you, Angie from Sandberg. If kids are going to eat lunch in the classroom, they'll be taking off their masks. Her classroom does not have a window. What are we doing about that ventilation? I think Mr. Farley talked about that a little bit. Can we take the kids outside to eat when it's nice? Is there an alternative?
Great question, right? So multiple probably layers to answering that. First piece, opportunities to be outside to eat. We want to try and take advantage of those, but certainly we know that's not going to be a daily opportunity, right? So while we have a team that's going to really be looking at lunch and what it looks like right now, as we plan on lunch being eaten in the classroom, I think first piece, right, you got to have proper ventilation, and Mr. Farley's addressed that as well. The second piece is students will have their masks off, but our desks will be physically distanced. So there will be that piece happening, but certainly lunch would be in the classroom for the most part. Can you eat outside? Yes. And then the second piece is that we're still also gonna have to take into consideration students with allergies and identify some locations for them as well, if need be. But certainly the desks being distanced during the time of lunch will take place, but students will be taking their masks off to eat within the classroom. But on the second side of that, as we work out those logistics, we do have a team that's going to be working out some more logistics further on that.
And Chris, let me add one piece onto that too. My assumption and what I know is that there's going to have to be some building specific planning. So again, we can provide general answers on how they're going to apply across the system, but we know with 13 different elementary buildings, what works in one building may not work exactly the same in other buildings. And so if there are some individual classrooms that based on the physical design of those classrooms or where they're located, that we have to make different arrangements for around something like lunch, there will be obviously a building level autonomy to work through that. So we can establish the parameters that will apply across the system, but each of our principals and teams at buildings will have to look at some specific nuanced situations where we need to make individual plans.
Thank you. The next question is from Carrie Eichstad. Mr. Farley, this question is probably for you. Can you please clarify the difference between cleaning and disinfecting? Both terms are used in reference to procedures after eating in classrooms, but they were entirely different things in our experience before the shutdown.
Sure. We will be using a disinfectant or provide a disinfectant that can be used on desktops after food is consumed in the classroom. That has to occur after every meal and before instruction can start. We obviously have cleaning practices that will be enhanced as well in the classrooms after students are in the classrooms, and obviously work to try and make sure that the areas are cleaned thoroughly each night.
The next question is for Christy Kuntz and Dr. Kyle from B. McGuire. Will teachers have the opportunity to teach remotely if they are well enough instead of depleting sick days if they're required to quarantine but they feel well, e.g. waiting for COVID-19 test results, have a confirmed COVID-19 diagnosis but have a mild case?
Well, that's been a question, and we've talked about it. Obviously, right now, in elementary, kids are coming in every day. So there's a couple ways to look at that. There's a way to get a substitute in while that teacher's out. We haven't talked about the possibility of somebody teaching remotely. And Christy, speak up if you have any ideas, but I know we've talked about, at least at the middle and high school level, students are coming in, we still would need an adult there to supervise, to be with the kids. So I don't think that would be any different for elementary, but we'll continue to work through that process as we get closer to the start of the school year. Christy, speak up. I missed it.
No, I agree, Charlie. I mean, in the event, if it was somebody who was doing an academy, a virtual academy, that obviously might be easier for that individual to still continue to do that while they're quarantining. If they're supposed to be in the building, we'd have to look to see how we would, go through that process as well too. So it just depends on obviously the situation and the teaching that's going on at that time.
Christy, there are still some provisions in place underneath some of the emergency legislation that was put in place that actually provides protection for teachers should you need to be out. So I guess, Christy, maybe you can comment on that, but please don't assume that if you have to be out for a short time that you're depleting all of your sick days. There's some emergency provisions around that.
For sure. Yeah. And through the guidelines from the Department of Labor, there are 80 hours, which is typically 2 weeks. That would be emergency sick days that employees are eligible. If they've been employed for 30 days that they can tap into prior to utilizing their own sick days as well too.
Dr. Szilagyi, you started to touch on this a little bit. Will all related services staff be given spaces where they can physical distance at least 6 feet?
Yes. Yes. As we've considered all spaces and really the space assessment has been an ongoing and really early part of our work. And we certainly, want all staff to feel and be safe. So certainly they will be given spaces where they can physically distance.
Okay. Will time be built into staff schedules to allow for needed health protocols to be followed? If so, how? Chris,
Yeah. Yes, they will be. We have a scheduling team comprised of teachers and administrators, and really building out some of those sample schedules is going to be the focus of our work. Actually, starting this week, we're going to really ask some of our teachers to build some sample schedules. There's already been some conversations around what that looks like. But certainly we know that we're going to have to build in time, not only for hygiene practices and health protocols, we're going to have to build in time for kids to have breaks from their masks, for staff to have breaks from their masks. So the time considerations and some of those impacts are things that we're looking at very closely. And we're engaging some teacher groups on that as well, so that we can truthfully during this month be able to bring back to our elementary teachers some sample schedules and things that we that are workable and that will give you some context for what the day can look like for your kids. A big goal of ours is that we want our kids and staff to feel comfortable and safe as we bring them back to school. So certainly the schedule plays into that. It's going to look differently, and we know that we're not going to have as much academic time, but we're still going to have time, and in some cases maybe some more flexibility with with our day within the classroom as well.
Chris, this next message is our question is for Chris and probably Erica Ekstrom from Aaron Young at Emerson. Wondered about clear plastic masks for students receiving speech services, and then our younger grades, EC through 1-2.
Erica, do you want to take a stab at that from a special education standpoint? I'm happy to take it too. I mean, there's some special education provisions, and I will tell you for all students, without an extenuating circumstance, that masks are required. But Erica or anybody else, I'll let you dive in on kind of the provisions around what would allow a student to not have a mask and have the face piece because of some of that.
Yeah, our special education subcommittees are working now, looking at the recent guidance to look at what accommodations are needed. And so almost all of our students are going to be able to wear a facial covering of some type. Now they might need accommodations, and right now our subcommittees are working on gathering that list of accommodated PPE, whether those are clear communicator masks that include that face shield that is built into the mask. So it's not a face shield, but it is a mask that includes that clear facial covering that allows you to see their lips, whether that is a PPE that staff wears so that so that students can see teachers' facial expressions, or vice versa. It is a mask that students wear either during an evaluation or during a speech session, or whether there are accommodations that need to be made, such as direct and explicit instruction for sensory desensitization, or accommodations to how the mask is worn, is placed around the ears or on the face, to help support students with their sensory needs. But we do have IEP teams that are working on social stories, visual support, as well as guidance on how to support students in the event that they need an accommodation for facial coverings, so that both students and staff are safe at school.
One more thing that I wanted just to add into that, if you have a need or an opportunity to stop by the school service center or one of our offices, what you'll see in that any of our like desks that are public interfacing, right, in the office. Obviously, if you've gone to the store, you've seen the sneeze guards that are up everywhere, and so our facilities department has built those sneeze guards to actually be mobile, meaning instead of being permanently affixed, they sit in a frame. Most of them don't move, but I mention and share that because that's something that will continue to perhaps be an option in specific circumstances as well, where in addition to the PPE, we have those kind of mobile, plastic sneeze guards that can and probably should in some circumstances be used as an additional layer as well. And it's not the way that they've been built; they are truly mobile. So if you're a specialist, it wouldn't mean that you have to have that up right at all times, but as you're serving some students, it may be something that's necessary to be used as well. So there are a lot of options that will be available. And again, I think a lot of it's going to be student-specific or staff-specific needs that guide what makes the most sense. But from a PPE, last thing I'll just mention from a PPE perspective is that our intention is to make sure that we provide that personal protective equipment for all students and staff. And so even though ISB recently re-released guidance that talked about the difference between a face shield and a face mask, we are still purchasing a variety of PPE to have available to staff. So we may have a standard that we apply or we give to everybody, but then some options that are available based on specific need.
And we're going to try to have a little fun with it. The masks that we give out to our students and staff will be branded with your school logo on it, so that we're going to have a little fun with it, guys. Next question is, I think we've kind of covered this, so I might just take this, Dr. Kyle, unless you have anything to add. From Tori Rebholz, I'm concerned about working a full week and my middle schooler will be home part-time alone. what options might I have? I think, Tori, that is something that's going to be possibly asked in that staff survey, and HR will work with individuals on a case-by-case basis to address that.
You got it. The only thing I would include going back to the plexiglass is I'm the plexiglass guy as well. So I've been working with building principals, going to each building, finding areas where plexiglass needs to go. We're making them nurse's office, front office, LLC, areas where you have interaction. Teachers, of course, like Dr. Sloggy said, every teacher, every support staff will have a 6-foot distance. We were going to do shields for all teachers, and then the ISB flip-flopped on that. But we are ordering shields as well, because they may come into play for certain teachers that work with students that want more protection. So we, like Dr. Schuler said, we are going to make sure you have the PPE to be safe in this environment.
Next question is Dr. Salagi from Gale Riss. As a resource teacher, I would like for my students to come down to my room. Then I am only exposed to my caseload and not all the students in the classroom. Will that be an option for me?
Yeah, really good question. What I will say is the one part that I can answer is that students will be able to move throughout the building. It's really about monitoring who those students are and where they're going and the places they're going, and then are they distanced. Can we only have students moving to one place? I think the answer to that question is it might be specific to your situation or the school situation, depending on who's on your caseload and what those minutes look like. What I can tell you, if there are minutes that are needing to be push-in minutes or some of those different pieces, then we'll have to look at that specifically on how we allow our staff when they're interacting with students to still have that 6-foot distancing. So again, the second part of that question is probably more specific to your given situation. But what I can tell you is groups will be able to move 4 resource minutes to a resource room if they're minutes that are given outside of the classroom. If there are minutes that are supposed to be push-in minutes, we're still going to have to provide those minutes. How and who that is, I think, is building specific.
Dr. Salagi, next is for you too, from Katie Ekstrand at Longfellow. She's concerned about all-day kindergarten, the expectation that kindergartners will be required to wear a mask all day, as well as sit in a chair without the natural movement that we normally can have in the classroom, like centers, daily 5 guided groups. Is there any consideration for 80K to be off the table and all is just half-day kindergarten?
Yeah, Katie, that's a great question. I think, the first piece I would say is all-day kindergarten is going to be new for a lot of our kindergartners coming in the building. Our plan right now is to bring our students back full day, but we're going to be very, very, I think, aware and sensitive to what that experience looks like. Not only are we going to look at instructional schedules from one side of the team, Mrs. Murphy also has a team of all-day kindergarten teachers that are going to look even deeper at what that day will look like. I also think, while it won't be traditional, that there is going to be opportunities for movement in the classroom. Underneath some guidelines, there will still be opportunities for movement within the classroom and outside the classroom. We're also going to have to be cognizant of what breaks look like, what student interaction looks like. But at this time, certainly it's a valid question, but our goal is, as we weigh both of those pieces of the opportunity to bring our students back full time, the benefits of that versus some of the other pieces. Now, I do think we're going to have to be creative in our planning, and that's where we're going to have to use really our teachers in some planning groups. So at this point, we are planning to run a full day kindergarten program.
I'll just add on to that, Chris. As you alluded to, and Katie, I believe you're on the team who will get to work and really think deeply about kindergarten itself. We're pulling together several kindergarten teachers to specifically talk kindergarten, because we know kindergarten is a different experience. So we can put all the thoughts that that group wants to discuss on the table and work through together.
The next question is probably for Mrs. Murphy, but Mr. Mack, can you unmute yourself too? It's from Cindy May at Whittier. Reopening plans state that grades 1 through 12 will be assigned Chromebooks. Also state that states that devices will be available to each student in an elementary building. I'm wondering how tech will be utilized in school and remote learning for ADK as well as PTK. I'm not sure what PTK is. Will 5 hours of instruction time be required for ADK? How will that look for PTK?
Part-time kindergarten.
Part-time kindergarten. Thank you, sorry.
So there's a lot of questions in there, and I think Rod can take the specific logistical device questions, and I can take the instructional answers. If you want to start, Rod.
Yeah, sure. The amount of devices, because we made the move this summer to go 1-to-1 at the high school, all of the high school units being shuffled down through the middle and the elementary gives us a count where we have enough for every student K-12. There are committees working at the elementary level, middle and high school level about what that actually looks like in each building. They're going to kind of do a tight loose as to what it is in each building. I don't have real specifics on exactly what it will look like at the kindergarten, first grade level as of yet, but there will be devices again, so students at least won't be sharing when they're in the building. Some of that the more detailed answers will probably come at a later date as these committees continue to work.
In terms of usage in the classroom, we know that our kindergarten teachers will have access to the digital subscriptions that the board approved recently, which would be Zern, and also Literacy Footprints was purchased for kindergarten through third grade teachers. We also still have a subscription to Dreambox that can be utilized in the classroom. Additionally, in terms of if we had to move to an e-learning environment, ISB has that requirement of 5 clock hours of learning for our full day students. That is what we would need to do. But for our halftime students, I do not believe that is what we need to do.
Dr. Schuler, I'm going to give this question to you. At the board meeting, there was one comment regarding staff safety. What considerations have been taken regarding staff safety prior to asking us to return to a high-risk working environment? From Kelly Lynch.
Yeah. So let me come back to staff safety across all of our work teams that have been putting protocols in place. Chris has led a lot of the physical distancing teams. He's also worked with Sue Vasco and the health planning teams or health protocol teams. I want to assure you that that's all been about staff and student safety. And so as I reflect on last night and saw another message that came in earlier, if we did not make that explicitly clear, that my apologies for that. Again, I think our effort last night was to try to cover as much as we could in that time that we had. But to answer the question, obviously staff safety has to be of the highest of priority, because in the same way that what we shared last night, our goal is not just to get schools reopened in whatever format, it's to be able to keep them open. And so if we do not have protocols in place to make sure that both staff, students, anybody inside of our buildings are safe, we can open our schools, but we're not going to keep them open for long. I will say in terms of local context, and so we've shared this a couple of times, right? The Illinois State Board of Education and a lot of the planning documents that they've released are really geared toward helping people figure out how they're going to reopen schools. Once that happens, it's the local health department, it's the DuPage County Health Department that we will partner with on a daily basis as we respond to specific situations that will help give us guidance on what do we do, right? And so if and when, because it's really a when, not an if, when there is a confirmed case within the district, Sue Vasco and the building specific team are going to work with the health department to determine what the appropriate response is. When is it that a classroom, perhaps in a building, would need to be closed for a period of time. And again, I share that to be honest, but having good staff safety protocols prevents that from needing to take place. And so again, I'm hearing loud and clear that we need to be very explicit on what those protocols are and make those available and make those transparent to staff. And please know that they will continue to be. But if we do not have that as our beacon and our priority, we are not going to keep schools open. And so I don't want to just open schools on day one. I want to keep them open for the entire school year. So it has to continue to be a priority.
And
Thank
Dr.
you.
Schuler, just to add to that, the survey that's going to go out this Friday, normally we send the protocols on what to do if you're sick or what to do. We have a whole set of protocols, about 5 or 6 slides. We are going to add that for all staff. And just to go back to the question, I've worked with Penny Coyle and Bryce probably more than I've worked with the SLT this summer. And our goal, our number one goal is always to make sure that the staff is safe and to make sure that we listen to what the questions they have and the needs they have. That's part of what our survey is going to be, is to see what else we've missed or what else we might need to do and reasonable accommodations to get ready next year. But I just wanted to share that those are some pieces as well that we're going to do. Just so you may be thinking right now, like, oh, what do I do if this, and this happens? That will go out with the survey. Take some time to read that. It's worked at the SSC. We've had 0 COVID cases. We're on week 6. High schools and middle schools came online this week. If people follow the rules, follow the protocols, we want to keep schools open.
Thank you. Next question is for Dr. Salagi from Laura Belanca at Pleasant Hill. How is the social distance measured in elementary classrooms? 17 to 22 kids in a classroom is significantly higher than other districts like 41. Lisle and Darien will have no more than 15 kids in a class. I am concerned for the safety of my students and myself.
Yeah, certainly we've measured ran student scenarios in a lot of classrooms over the summer just to get a feel for this. And really, as we look at classroom, first of all, it's going to be determinant upon the space of the classroom. So you got to look at the square footage of the classroom and then the distance between student seats. And really, as you start to plan that out, that allows you to understand the enrollment and capacity that you can have in a classroom, where really the majority of all student seats are 6 feet apart. We ran a few of those student scenarios past our local health department as well. So really, as we look at our classroom spaces and our student seats being separated, when we look at those arrangements, we can really get seats 6 feet apart, where students are 6 feet apart from all other students, but in some cases they may be within 4 to 5 feet of 1 or 2 other students, but 6 feet away from every other student. So we certainly know that means we're going to have to lower some class size thresholds as we go across it. But as far as measuring seat to seat, we've done that while also taking into consideration that we have to give our teachers and adults in the classroom space as well. And we ran those scenarios past our health departments as well to make sure that our students are physically distanced as much as possible.
Thanks. Just want a reminder to everybody, if you have put a question in the chat bar that's already been answered, I am skipping over that just in the interest of time and because we've already answered it. So please don't take personal offense to that. The next, Dr. Schuler, I'm gonna ask you to answer from Kelly Lynch at Whittier. What safety procedures will there be for students who come to school without a mask or refuse to wear one?
Yeah, so let me answer the second question first. That will not be an option. Students do not have an option to refuse to wear a mask. One of the things that Dr. Kyle and I actually just reviewed this morning is a draft board policy on face coverings that we've asked our attorneys to draft. So even though that is a state expectation that there's no choice around, we're going to codify that in board policy as well. So not wearing a mask will not be an option. If a family indicates that they're simply unwilling to wear a mask, then their choice will be the virtual academy, right, as an option. And the board policy, well, we hope and don't anticipate that we're going to end up down this road often. The board policy gives us the latitude to either make that decision to simply remove a child from the school environment entirely, and or utilize whatever disciplinary measures that we need to in that. As far as the issue of what are you going to do if somebody just simply forgets, and that will happen. That'll happen on the staff side as well, that somebody's going to come to work and realize, shoot, I left my mask at home. As we're planning and preparing for that order of personal protective equipment, we will make sure we have additional that is available. So if somebody has simply forgotten, it's not simply that they're saying, hey, I don't want to do this, but I forgot. We will have an extra supply that we're able to provide.
Thank you. We are at 10 o'clock, but we did get started a little bit late. So if your schedule allows, we're going to go for a few more minutes. And I will tell you, I continue to be impressed with our staff. We at our height have had 352 elementary staff tuning in, which is just another indication of how incredibly dedicated our staff are and truly care about our kids. And we also have 75 more questions that we are in the chat bar. So again, we're going to go for a few more minutes, but please know that I will have a transcript of the entire chat bar, and we're going to do our best in the short term and long term to get all of your questions answered so you feel the most prepared for the start of the school year. Next is for Dr. Szilagyi. Will elementary hours be the same as last year? This is from Jennifer Rath. Will elementary hours be the same as last year? What is considered full day?
Yeah, we have a team that's looking at that right now. Certainly, some of the things within the elementary classroom, like lunch, arrival, dismissal, are all considerations that we're looking at. So there's really two groups that are looking at what that elementary full day experience will be. Dr. Kyle's leading an HR team with WWEA union leadership. Then we also have a scheduling team that I really think is almost walking jointly alongside that piece. It's going to really start looking at that elementary day and how it looks, so that we're really thinking about that. But the full day in that piece, could there be some adjustments to what that full day may look like? There may be, but still, when I do think full day, or as we use the terminology full day, we're talking about a full day of instruction with possibly some adjustments for lunch time, all those different pieces that we're looking at. So we don't have the full answer to what that will look like, but I'm confident that we will in the coming weeks, and we have I think the right processes and people in place to work on that.
Hey, Chris, let me one clarity around that, and Melissa help me with this. So in our existing elementary day, we're actually not significantly beyond the state minimum for required hours. I believe the instructional day has to be 5 hours, right, per state of Illinois, separate and backing out lunch, recess, that hour that sits in the middle of the day. So whatever we do in a combination of in-person and or any asynchronous experience, it has to be 5 hours. That's one of the changes that the state did make. So even if we find ourselves as a system back into fully remote or fully learning at any point, this year that experience will have to be 5 clock hours of either synchronous or asynchronous experience for kids.
And I'll add on to that, Dr. Schiller. So we have teams, Danielle Moran and Sean Walsh are leading teams that are devoted to ELA and math, and really going to put some, I know they're working on guidance around what makes sense to be synchronous, what makes sense to be asynchronous in our instruction. And then we're going to bring that to our instructional scheduling team of teachers and principals to really work through some samples of what an e-learning day will look like, with that additional time that ISB now requires.
Thank you. Dr. Schuler from Kelly Lynch at Whittier. If a student from one level, i.e. middle school, has been diagnosed or came in contact with COVID, will the schools of siblings of that individual be notified and quarantined as well?
Yeah, good question. So there are kind of two answers to, I guess, two questions embedded in that. One is just the question of who actually is quarantined in a situation. And so answer to that will be, in any confirmed case, we will work with the health department to do with the family contact tracing, right? So contact tracing identifies the specific window of time where the individual is contagious or is shedding the virus, and there's a very defined window where that takes place. So from the very first onset of any symptom, the 48 hours that preceded it is that window of time where somebody is shedding the virus, is the term. And so contact tracing really involves working with the individual, student or adult, to understand who did you have close contact with in that 48 hour window of time. Close contact is defined by less than 6 feet apart for a sustained period of 15 minutes or longer. So even, incidental contact, passing somebody in the hallway, talking to somebody for 2 minutes, that's not going to be, it's not identified as a close contact. So a lot of information to say that exploration really identifies who needs to be quarantined. In almost all situations, those individuals in the same home were very likely in close contact with that individual, and so they would be asked to quarantine. But whether there would be impact on that building would actually depend on whether that sibling, even if they were asked to self-quarantine, at any point started to show any of the symptoms. The second part of that question is notification, and the balancing act with notification is going to be the when individuals may have been in close contact, and if we can't determine who they may have been in close contact with, then broad notification is likely appropriate for that situation. But you have to remember in all of those circumstances that the individual that tested positive for COVID-19 does have a right to privacy, right? Their medical information, we don't have a right to simply broadcast it to a larger group of people than those that need to be aware of and know that information. And so, again, there are times when it will likely be appropriate to do broad notification if we're not certain who a person has come into contact with. And there are other situations where if we know definitively who they interacted with, we'll share that information with those individuals, especially if the health department is recommending a quarantine. So in all, and obviously school's not in session yet, but as we've reopened across the district, we've been very successful in any situations where we have had to do contact tracing in being able to do that very quickly. That candidly is the other reason when you see the procedures that Christy will send out from the Human Resource Department, is why we do ask staff that if you are experiencing COVID-like symptoms, to please let your supervisor, let your employee, your employer know immediately, in addition to staying home, because if we do need to contact trace, we want to do that right away, right? That's easier if you can do it right away.
Thank you. Next question is for Christy and Charlie. From Amy Kovarik at Washington. Can staff take unpaid leave for this upcoming school year and still have a job the following year?
Christy, you want to handle this since
Yep.
you leave expert?
Yeah, it's a good question, Amy. I guess we would have to understand the reason for the leave. Obviously, it's the same processes and procedures we do have in place for our district. So prior to approving any leave, we would just have to have a better understanding for that reason and work with that individual.
But Christy, we do have leave options, right? And if somebody has been approved for a leave consistent with board policies, then they do have a job when they return, correct?
Of course, yep.
Yes. All the same leaves still apply that are in the contract.
Next is again for Christy and Charlie from Kathy Maurer at Jefferson. I am concerned that we will not have enough subs this coming school year. I have a concern about subs being trained on our safety procedures that will be new this year. Do we have a plan to recruit and train subs?
We've been recruiting subs for the past couple of years. We continually try and bring more and more subs in. Throughout last year, we brought in a number of subs and trained them. This year, we have been talking about before the school year starts to try and bring the subs in groups of less than 50 or do a Zoom all at one time to share the new safety protocols that will go into place. So they're aware, so they feel safe and comfortable and they continue to work with us. Christy, if I'm missing anything, I know you have probably more of an accurate count, but I know we had 4 different meetings last year with about 12 to 20 subs. We continually bring them in. And my guess is with unemployment so high, I think we will have subs next year and we will train them and have them ready the same way that you'll have training when you come in for your staff days. Sue Vasco, Chris Slaggy, they're working on training that we're going to need to take time before we start the school year to make sure faculty, staff, students are going to have to know that. Same thing are the guest teachers. So they're on our mind. We haven't scheduled it yet, but once we start figuring out how we're going to train faculty, staff, we'll give the same training to our guest teachers.
The next one, Dr. Schuler, you started to answer. So, but Chris, if you could be prepared too, because I know you've been working closely with Sue on health related. From Carrie Eichstadt at Whittier, what if student staff have a COVID symptom as a symptom of a different condition? How will the monitoring of symptoms be handled? For example, cough variant asthma involves a cough which is similar to the COVID cough. Will a doctor's note be needed?
So I assume the question is, would a doctor's note be needed to allow that person to continue to report to work if they're showing a symptom? And again, as with a lot of these answers, there are going to be some like individual specific circumstances that we need to work through, and we've done that. Again, I use it as the example is because we've reopened that. We've had a lot of those discussions with folks even at the school service center who have said, gosh, one of the symptoms on the checklist has to do with like a sore throat, and I know I have an allergy. I know that it's allergy related, and so if it's allergies and I know that it's allergies and I'm not showing any other symptoms, can I still report to work? And the answer is yes, that we will work through individual circumstances with folks as needed. We're going to, for this upcoming year, encourage everybody to obviously err on the side of caution. If you're sick and you know you're sick and you don't know what it is, stay home, right? We really do want you to stay home and take those precautions, but yes, we will work through individual circumstances. Christy, anything you want to add into that?
No, I think that's, you covered it all there perfectly.
Melissa, the next question is for you, from Margot Brown at Sandberg. Are we going to have a modified report card again for first trimester?
Julie Ozymkowski has a team that is dedicated to assessment and grading. And so they're working through those questions, but at this point in time, we're not anticipating making any modifications to the report card.
Thank you. Dr. Szilagyi, I'm going to give this one to you from Laura Belanca at Pleasant Hill. The districts that have published elementary plans have overwhelmingly done a hybrid of e-learning and in-class learning in elementary level. Why are we having all-day class? It is unreasonable for small children to wear a mask for 5 or 6 hours a day. It is unreasonable to expect that 6-year-olds, as much as I will try, will social distance for that amount of time. But 2.5 hours in a split schedule is a whole different situation. What factors were considered in this decision?
Yeah, I think the first piece is weighing that there's no replacement for the in-person experience for our youngest students. But certainly a lot of factors go into those considerations. First and foremost is the resources and the consultation with the health experts, right? The Illinois State Board of Education, Department of Health, our local health partners. And so I think that's the first piece is the ability to bring our students back so that we can meet their needs and be with them face to face. Laura, I think on the other hand, you make a really good point. It's gonna look different. It's gonna be challenging. We're gonna have to build breaks into the day. We're gonna have to build a lot of different times and structures into the day. So certainly when you're weighing that half-day experience or a on-off experience, A/B type experience versus the opportunity to bring our students back, our youngest students back to benefit from in-person daily instruction, especially as you work with your health partners to clear that path. Certainly that is a place that can benefit our students most. So certainly don't disagree that there's going to be challenges. I believe we can work through them. We'll work together on them. And certainly it's going to look differently, but I believe when our kids are with us for a full day, that's when they're benefiting most.
Jeff, Bill had to jump off the call, so I don't know if this may be for Jeff or Chris. From Sarah Logan at Bauer, are teachers responsible for cleaning at all during the day? If so, what are the expectations?
Yeah, great question. So I would say in terms of general cleaning expectation, we're designing cleaning protocols that will be carried out by our custodial staff, and we have identified a need to likely increase that support as we move into next year. I think cleaning in general, right, keeping your workspace, keeping the spaces that you use clean is going to have to be a shared expectation this year of everybody, students included, right? And in that, I believe part of the routines that we're going to be teaching kids at all levels and adults at all levels is that beyond the regular scheduled cleaning of areas and surfaces, the bottom line is the cleaner we keep the spaces where we work, the less potential there is for virus of any kind, right, to transmit COVID-19 or otherwise. So I don't want to say or suggest that staff members aren't going to share some cleaning responsibility. I don't anticipate that there's going to be a cleaning schedule like built into your day that we're going to say, hey, you need to go clean this particular area of the building. We're going to organize that. But I think making everybody aware of the need to keep spaces clean, right? Your individual workspaces and the spaces you use, that's gonna have to become a shared expectation we're going to work toward this year with everybody.
Thank you. And we're knocking on the door of 10:20, so we're going to do one more question. We do have 82 more messages that were sent in, again, that we will get answered at some point. So Melissa Murphy from Katie Ekstrand at Longfellow, is the district looking into purchasing the extended version of Screencastify for teachers if we go into remote learning?
No, we haven't talked about that at this time. I think there are free tools like that could be used in that case. But we can add this onto the list of things to continue to talk about, especially with Lee Cook and digital tools teams on like free resources and options for Screencast.
Well, I will just say, and then I'll let Dr. Schuler wrap it up. Thank you so much for all of your questions and your engagement today. And please know, as I shared, I do have a record of all the questions that were placed in the chat bar, and we will do our very best in both the short term and the long term to answers all of those questions so that you feel most prepared to start the school year. Dr. Schuler?
Yeah, no, Eric, I'd summarize with the same thing to say we want to continue to partner with you as we work through this the start of the school year. So I appreciate your questions. I appreciate the questions you're going to continue to send both to us at the district and to your individual buildings. We want to continue to partner with you in not only answering these questions, but engaging you and helping us to answer this. I think as we move to the start of the year, I've shared a couple of times that I think we've developed routines and procedures for the opening of school, right? We know how to do that on a year-over-year basis, and this is a different year. So a lot of what we're used to is getting upended, and so just keep partnering with us as we find these solutions, and we appreciate your time in joining us this morning.
All right, well, thank you all so much for joining, and I did put in the chat bar that yes, we did record this Zoom, and we will make these Zooms available to our staff. We'll record the middle and high school as well. Thank you all so much.
Thank you.